Hello, everyone, and hopefully you can hear me okay. Welcome to the July 2025 NSFT Research Lunchtime Seminar Series. And a big warm welcome to our guest speaker for today, who's Professor Simon Willmoth from the Norwich University of the Arts. So as usual, what our format will be is that we will hear from our illustrious guest speaker for around half an hour or so, followed by a Q&A. So the Q&A will be driven by you. We have a Q&A function enabled in this Teams meeting. We encourage you to put your questions on there throughout the course of the session. And those questions which have the most thumbs up, so please vote on the questions, will be given priority at the end of the session in case we're running short of time. So it's entirely in your hands which questions will be asked as well. We are going to be recording this session and it will be published on YouTube, but we will stop the recording before the Q&A. So don't feel shy about asking any questions at all. So just before we get going, a quick plug for the next seminar. So we're going to have a bit of a break in August, and the next seminar will be on Wednesday, the 24th of September at 12:30 again, where we'll be hearing from Paige and Ella, who work on the Limitless 2 trial. And this is a National Institute of Health and Care research funded study, which is led by NSFT along with the University of East Anglia, which is aiming to improve the mental health of young people in care. So that's what we'll be hearing about in September. If you want to catch up on our previous seminars, we have a YouTube channel, and that's the link to our YouTube channel, which I'll also put into the chat a bit later on. So far this year, we've had Professor Rebecca Gould talking about contact gag study in older people's anxiety. And last month we had Tom Rhodes speaking about the WOW study, which implemented and evaluated parent-led CBT in primary schools across Norfolk. So without further ado, I'm going to hand over to Professor Willmoth, who will be taking it from here. So thank you.
Thank you, Bonnie. I hope you can see my presentation on the screen. Good afternoon, everyone. Thank you for inviting me to present. And I'm going to talk today about artwork at the River Centre, Helsden, and the Home Project, the Hospital Murals Evaluation project that Norwich University of the Arts has been working on with NSFT and the Jameel Arts and Health Lab, which is leading the project. It's an international project led by Jameel Arts and Health, which is based at New York University. So I thought I'd start with some very brief details of Norwich University of the Arts, as some of you may not be aware of the nature of the university. Some people even think that we're part of UEA and what's known across the city usually as the Art School. So Norwich University of the Arts was founded in 1845 as the Norwich School of Design to improve design within manufactures, and then it became Norwich School of Art, the Norwich School of Art and Design. It's then in the 80s became Norfolk Institute of Art and Design when it joined with Yarmouth College, and then it got a University College title, Norwich University College of the Arts, in 2007, and we've had university title since 2013. The government reduced the number of students you had to have to get university title in 2012. It used to be a minimum 4,000 and they reduced it. So we have 13 buildings currently in the centre of the city on what City Council has now called the Cultural Quarter, which is around St George Street, Duke Street, St Andrews Street in the centre, near Cinema City. They have around just over 2,500 students doing undergraduate courses, master's courses, and studying for PhDs. We have a programs in, fine art, graphic design, illustration. We now have acting for the last 4 years, games design, film and moving in image, and we're just starting a psychology degree at Norwich University of the Arts. Our creative health research has been working with NSFT and hospital rooms and independent arts organisation since 2020. Our creative health research focuses on mental health and well-being. It's a key part of the research strategy of the university. It's not the only research we do, clearly, but this programme for creative health focuses on mental health and well-being. We have had 2 projects at Northside House, and obviously the major one at the River Centre over the last 3 years. We also have a project with the Julian Hospital, work with NSFT, and we've been working with the Restoration Trust, with a group with ongoing mental health issues in a community of around live in Yarmouth and Galston for around 3 years now. So that's what we do. This is work from the first Northside House project, working again with NSFT and hospital rooms to install artworks in the wards and on the corridors at Northside House. This is by an artist who works at the university, used to be head of fine art, called Carl Rowe, and we've been also the Northside House 2 was a project where we, with hospital rooms, NSFT, we transformed this old workshop, which was disused. There really wasn't staffing for it, from this environment, which wasn't being used anymore, into a hub which can be used for people to meet, to have creative workshops, to play pool, to have music and drama sessions at Northside House. And one of the things we've been doing there is that we've had ongoing creative workshops led by my colleague Carl Rowe, and with the OT team at Northside House since this project was finished about 2.5 years ago. So part of what we do in our research is a kind of legacy from when artworks have been installed in mental health environments. We continue with creative workshops with staff and service users within those facilities. So the River Centre Helsden project has been led by hospital rooms over the last 3 years. As some of you will know, 15 artists have been involved and commissioned. There have been 70 art workshops delivered over that period, and around 20 artworks have been installed at the River Centre, mostly in the new wards and the environment of the new wards at Helsden. Our research there has, as with the North Side, has been focused on evaluation of the project. How does installing these artworks and the process of installing these artworks improve? Does it improve the environment? What is the response for service users and staff, particularly to this new work in those environments? And we've had a lived experience team working with my colleague, Dr. Nicola Simpson, again, over the past 3 years, to be involved in helping us to develop the evaluation framework for this project. And I hope some of you will know some of the work that's been installed at the River Centre. Haven't got time to show it all to you, but this is one work by Holly Sanderford, who's a Norwich artist who studied at Norwich University of the Arts and works with us as well now. She installed in work similar to this in each of the quiet rooms across the 3 new wards at Helsden. This is a work by Sola Ulode that's in the gym at Helsden. And so I'll come on to the home project, the Hospital Murals Evaluation project, which has been running for the last just over nearly 2 years. It's a project which aims to better understand how murals impact service users, staff and hospital visitors. And by murals, we mean artworks on walls. So you may know that there's a number of sculptures as well at Helsden at River Centre. This project doesn't focus on these, it just focuses on the artwork on walls. The projects are led, as I mentioned before, by Jameel Arts and Health Lab, which is based at New University and is funded by the World Health Organization. So this project has 4 sites, with research being carried out to evaluate murals at Lagos University Teaching Hospital in Nigeria, at New York City Hospital, particularly the one on First Avenue, which I think is called Belleville, the University Children's Hospital in Ljubljana in Slovenia, and in Norwich at the River Centre, Helsden. And that research is being done clearly by Norwich University of the Arts. And the research we're doing is independent of NSFT and of hospital rooms. So the evaluation that we will develop as part of this project is completely independent of NSFT and of hospital rooms that has led the installation and the creation of the artworks. The research has had 3 stages. The first stage was a scoping review of published sources. So that's to draw on existing evidence about how visual arts impact well-being, wellness and belonging in healthcare settings. And that scoping review is in publication now. And then since January, we've been in the second stage with a lot of support from NSFT staff, people participation, particularly Joseph George, from ward managers and matrons, OTs and activities staff, particularly the teams working with Dan Brown and Deb Zagar at the River Centre. And this stage of the research has had 3 elements. A survey, an online questionnaire for staff and service users. And we kind of worked at the River Centre to help people access that questionnaire so that they can complete it online. And across the 4 sites, we've completed just over 400 surveys. 400 of those questionnaires have been completed. Then we've done interviews, again with staff, service users and visitors this time. And across the 4 sites, we've completed just over 100 interviews. And then the third element is a photo voice, an online photography element for staff, service users and visitors, where they're encouraged to take a photograph of one of the murals and then write briefly their response to that work. And we've had around across the 4 sites, again, around 75 responses submitted. And one point I wanted to make was that with Jameel Arts and Health, when they drafted the questionnaires and the interview questions, my team, myself and particularly myself and Dr. Simpson reviewed the questions and the wording at that stage of the project. And we had quite a lot of input to changing the wording and reducing the number of questions for that second stage of the research data collection. So Joe George was really helpful, creating some posters that were put around the site with QR codes for people to access the online questionnaire. Again, the online element of the photo voice as well. And we were talking to people about the work that had been installed at River Centre, across the wards, in the gym, on the exterior of the gym, some of which I'm showing you. We're now at the analysis stage. We're analysing statistics. I'm not, but somebody is analysing statistically, and we're looking at thematic content analysis, particularly of the interviews. The statistical analysis relates primarily to the reliability of responses across the 4 sites and compares these related to demographic data. The thematic content analyses responses according to inductive codes related to the different cultural context of each site as well. And so from that, we are starting to draft the final report, which will be published in as an academic journal article. Separately, Norwich University of the Arts will be creating an evaluation report for hospital rooms on the River Centre solely. All of the responses in terms of questionnaire responses, in terms of the photo voice, and in terms of interviews are all anonymous. The online submissions are completely anonymous. The interviews are anonymized, and that's a key kind of part, obviously, of the data collection and analysis research. And I thought I'd just briefly put down some themes that have come up. By this stage, we're not complete with this stage of the analysis, this third stage of the analysis yet, but some of the themes that have emerged, particularly from interviews, is the contribution of the artworks to the quality of the environment and potentially to recovery. So making wards more livable spaces, making the overall environment seem less like a hospital. Another theme is how artworks become focuses for discussion. And we'll see in a moment that some of that discussion is around the use of words and texts in artworks. The fact that people have different responses to the work, and that is important because it can create useful discussion. And then another theme is the importance of consultation with staff and patients, service users, lived experience experts. How that consultation takes place. Hospital Rooms, as I said, ran around 70 workshops, and the artists led those workshops, and the outcomes and the content that from those workshops informed the artworks that were then completed and installed, and there was some consultation with staff about where the work should be placed, and the nature of that consultation is a theme that comes out from the interviews. And then the location of artworks is key. Whether they've been put in the right place, whether they might be better placed elsewhere, other wards, other positions, for example, and how the project has been funded. There's been a fair amount of misunderstanding of this, and I would say some resentment has come across from staff with the assumption that the artworks have cost a lot of money and all of that has come from NHS funding, which is not the case. NSFT has put some funding into the project, that funding would have come from, I'm not sure what budgets it came from, but it would have come from budgets that couldn't be used for additional staffing, as that's one of the issues that's come across from interviews with staff. But hospital rooms themselves has funded most of the cost of these artworks, commissioning the artists, installing the works, the workshops, and it does that by having an annual auction, which is usually run by Christie's. For this project, it was certainly run by Christie's, the auction house in London. And hospital rooms get artists to donate artworks, which are then auctioned and then create funding for projects like this. And the last one that they had last summer, I think, raised just over £1 million. Some of which, and they do these auctions annually, and that goes towards funding the projects that they're involved in. And then finally, I know that Norwich University of the Arts, we put funding into the project right at the beginning of it. So that theme of how the project has been funded, I think, is important, and is one where I think there's some misunderstanding amongst staff within the service. And then another theme is how service users and staff involvement in designing and making artworks can continue or might be different in the future. And there's some very interesting ideas coming across from service users and staff in that respect. The other thing I would say is that people have said, there are no kind of titles for the works or identification of the works, and that is coming for the work at the River Centre. So the artworks, the artist, and the title of a work, if it has a title, something about the work, that material has been drafted and will be installed at the hospital. Some more images, and some of these I'm going to refer to in terms of the quotes that I've chosen. This is a work in one of the family rooms. So there's 3 or 4 quotes here I thought might be interesting from interviews, which raise some of the themes and issues that I've suggested. The member of staff says, I think having art itself within the ward environments is really helpful from my background, because it's one way of helping people to ground, to distract people, to encourage people to look at something different and to brighten the environment. I think all of those things are really relevant and genuinely helpful to people in acute environments. Then a service user said, when I saw the mural in the room, I felt it was like a human response coming to this into this kind of cold institutional space. It's like these artists have come into these cold inhuman spaces and put like a reminder that there's somebody out there. Because you get really isolated. The world kind of disappears a bit when you're in there. And so I was really pleased that there was this feeling of a person reaching out. Then a member of staff, one of the members of staff said, I find any of the ones that have got words on them, I think are a mistake. So on a male ward, choosing a piece of art that talks about nesting, I think in an acute environment, generally that's a bad message, because we don't want people to feel like they're going to nest in a place that's actually ever changing and is for acutely unwell people, not for people who are rehabbing or recovering. And that person was referring to this work as well. And this is a work on Sandpiper Ward, which is a male ward. And a number of people have said, is this appropriate for a male ward? Would it have been better for a female ward? Is another kind of comment on this artwork, particularly this series of artworks in the communal space at Sandpiper. And then this is the work that if you've been to Helsden, you would have all seen on the side of the gym wall, like Mark Titchener's huge piece, like There Is Hope and I Can Dream of Another World. which is a quote from a service user on a different project. And the service user said this, which I think is really interesting quotation. So that's the one I dislike. That's because I think that it's very wordy and it happens to be all in capital letters. It's got some colourful paint on it, but it doesn't really have any imagery. So I find that, to me, it just makes me feel a bit like I'm in an institution. And it's also very tricky when you're supplying art murals for positivity, whether the amount of it comes across as forced, like it's in capitals. This piece intends for you to be positive, feel positive. You'd read that and you'd know that the artist is self-conscious of making me feel positive. For me, because it says, like there is hope and I can dream of another world, well, some people are finding their dreams are distressing. And sometimes you're finding your senses distressing when you're in here. Also, in a better world, people wouldn't get poorly in the first place. It's just a little bit of a simplistic work. It doesn't cover like the heaviness. We are detained here. So there's a detainment factor. There's a fact that you might be having your dreams or your senses being weird. And then he says, like there is hope. So he doesn't even totally commit to the hope of it. Yeah. So all the words kind of jar a bit for me. Well, if I'd come in and the lotus flower one had been there, then that would have been really cool. I think that that deserved to be the showpiece. Just to take you back to the lotus flower that she's talking about, the one that's in the family room, one of the family rooms. So that's just to give you a sense of the kind of fantastic insight and engagement the staff and service users and some visitors that we've interviewed have with these artworks, and a huge range of responses. And it's the range of responses, of course, that we're interested in as researchers. We're not there just to get the positive, the reinforcement of the value of these artworks, but to find a range of responses and engagements that people will have. And then I'm just going to end with this poster for the exhibition that we had of the artworks at River Centre at the Fitzrovia Chapel in London. And we had a similar exhibition, which I hope some of you went to, at the Hungate Church in Norwich in July. And this showed kind of maquettes of the artworks that was installed in the hospital, as you see here. But also we wanted to bring works created by the lived experience team that Nicola Simpson, Norwich University of the Arts, has been working with for 3 years. And that team has been kind of so involved that they created artworks themselves, which we wanted to show at the 2 venues in London in March and in Norwich in July. So I hope that's given you some sense of the project and the research evaluation that we've been doing on it.